So I'm very pleased to open the Forensic R&D Conference. We fondly call our Forensic R&D domain FRED. So welcome to the FRED conference. We had one once before, and we have a really fantastic lineup for you today with really wonderful speakers. And I thank very much all of our speakers for agreeing to come. They were tasked to consider current issues in offending behaviour, because I think it's really important that we focus on what's going on and what's coming in the future. And you know, many of you will probably have seen recently the TV documentary where Broadmoor opened up our doors to the media to come behind the walls. What that programme did was an excellent programme, but what it didn't do was it didn't focus on the very strong and developing research programmes that we actually have at Broadmoor. So I'm hoping that you will see a slightly different perspective of what goes on here in terms of R&D. And of course, we're one of four high secure hospitals within the United Kingdom, and I believe that we have a role, an important role, if not a responsibility, to disseminate what we learn and to create a dialogue between forensic services. And that's why I wanted to develop Broadcasts from Broadmoor. As I said, this is our second meeting, and we're hoping to make this a biannual event. Of course, dissemination, though, is not for the select few who are here today. Dissemination should also involve our staff, our service users, our forensic community, and more broadly, actually, the public. And we are not here, and in all across forensic services, we're not in the business of just locking people up. We're not actually in the business of just providing a clinical service. And certainly here at Broadmoor, we are developing innovative ways to improve our practice, to improve our healthcare, and to manage risk and to protect the public. And so what we're doing here is we are recording all of these talks, and I'm very grateful to the speakers for agreeing for these to be recorded. What that means is that they will be placed online at the Institute of Mental Health website. That's actually listed at the bottom of this slide, but it's also on the back of your programmes. I'm not quite sure, it'll take us a little while, a few days to get it on, but because it's going to be on there, that means these talks will be widely available to all staff from our organisation in our trust, and also to other trusts and other organisations. An important thing, though, we are videoing, so please do not walk in front of the video unless you want to feature in it, walking across. And we do have some people sitting by the door who are going to remind people as they come in, if they come in late. The other thing to say, if anybody does leave early, there are feedback forms at the back of your pack. You will get your certificate when you give us your feedback and your badges. So that's the swap, okay? So you go back to registration, you give us the badge, you give us the feedback, and we give you your certificate. So I'm going to introduce now Nick Broughton, who is our medical director in the trust, and who's going to say a few words. Thank you.
Thank you, Susie. Good morning, everyone. Susie mentioned today's lineup of, I quote, wonderful speakers. I'm afraid I'm not one of them. I am merely the Trust Medical Director, which means I'm the Executive Director with a responsibility for R&D. I'm also, as some of you will know, a forensic psychiatrist. So for those reasons, I'm very pleased to be able to open today's programme. And I'd like to thank Susie and her colleagues in our Forensic Clinical Research domain for putting together such a great programme, which I hope you will all enjoy. Earlier this year, I spent some time in hospital, which as a doctor is always a useful experience, I think. And when I was lying there in my bed in the Brompton, I was struck by a number of posters I saw around the hospital, encouraging patients to get involved in research and development. And it had this rather snappy catchphrase on it: today's research is tomorrow's care. And I think that really highlights very concisely the importance of research and development. And in my opinion, I don't think there's ever been a time when it has been so important to support R&D. We are all aware of the economic pressures that the health service is facing. We're all aware of the difficulties, therefore, of maintaining and improving the quality of our services. And therefore, it is pretty obvious that to do that, we need to be thinking about doing things differently. We need to be thinking about identifying the best evidence. We need to be ensuring that we are delivering the most effective treatments to our patients. And clearly, R&D has a crucial role to play in that. I see it as an essential component of clinical governance. And it's for that reason that I am a little frustrated that as an organisation, West London Mental Health hasn't really punched above its weight in terms of R&D in the past. And I'm pleased that things are now changing through the efforts of colleagues such as Susie and the other leaders of our clinical research domains, and our new Director of R&D, Kevin Murray, who I really hope will be here, or else it's a little embarrassing. But we are moving forward, and I think our commitment to R&D is demonstrated by the relationships we are establishing, maintaining and developing with our key academic partners, Imperial, Buxton University, for example. It's reflected by our membership of North West London's Academic Health Science Network, which I think is now starting to realise its huge potential. It's reflected by the Institute for Mental Health, which we've established under Colin Martin's charismatic, inspirational and remarkably energetic leadership. And it's also reflected by events such as this and the work of Fred. I'm very keen to develop a culture across the organisation which encourages and supports R&D and also makes R&D available to all clinicians, makes it available to all service users and their carers. I think R&D cannot be the preserve of an academic elite. And that's why events like this are important, to communicate some of the great work that's ongoing and also to stimulate people, to make people aware of the great possibilities that are out there. I'm conscious that we're already behind schedule, so I think it's probably time to hand over to one of our wonderful speakers. But it's very nice to be here, very pleased to be here to be able to sort of lend some support. I am, however, rather embarrassed that I have to go back to Trust headquarters for a series of rather uninspiring meetings, so unfortunately I won't be able to listen to the programme, but I look forward to watching it on video. So Susie, thank you very much. To all of you, I hope you enjoy the day, and thank you for supporting us. Thank you.